Good afternoon. My name is Mason Barrett, and I'm a policy analyst with the National Organization for Rare Disorders. We are right in the middle of something called open enrollment, which is the time of year in which most people choose a new health insurance plan. We are here today to help you think through which plan may be right for you and how to know what to look for. I'm joined today by Jennifer Shumsky and Allison Harity, who I will let introduce themselves shortly. We will begin today's webinar with a short presentation by Jennifer and then jump into some Q&A. At the bottom of your screen, you'll see a button called Q&A. Please put any questions you may have over the course of the webinar in there, and we will try and get to them. Additionally, following the webinar, we will send out a recording and some links to additional resources. Please feel free to reach out to NORD at any time on the web via rarediseases.org/contact or by phone at 203-744-0100. Jennifer and Allison, over to you.
Thanks, Mason. I'm Jennifer Shumsky. I am a registered nurse, and I'm also a rare disease parent. And my expertise has been in access and reimbursement, which brings me here today.
And my name is Allison Harity. I'm a senior policy analyst with our team here at NORD. I cover our access to diagnostics portfolio primarily, and I am also a rare disease patient. And so I'll talk a little bit about my experience, with a policy background and also, as a patient. So I'll hand it back to you now, Mason.
Thanks so much for you both. Now I believe Jennifer has some slides to share.
Just going to do a quick kind of overview of some things. First, what is open enrollment? And for those that don't know, it's really just the window of time each year when you can make changes to your health insurance, such as enrolling in a new plan, renewing your current one, or switching your overall coverage. Outside of this period, you really can only typically make a change if you have a qualifying life event like losing coverage, getting married, having a child. And not all open enrollment periods happen at the same time. So, Marketplace ACA plans right now, open enrollment is happening. It's November 1st through January 15th, but that is state ruled. Employer plans, that is set by the employer. So typically windows though are open in October, November, but that can change. Medicare follows a national dates right now that is taking place from October 15th through December 7th. And Medicaid or CHIP plans, those are year-round enrollments. Next slide. So how to know what might have changed in your plan. Even if you're going to stay with the same insurance, you want to review any plan documents because things can change from year to year. If you have an employer plan, they're going to be required to submit a summary of benefits and coverage document before your open enrollment starts. This is also typically true with ACA plans. You can always request a copy of this if you didn't receive it. For employer plans, you can get that through HR. A lot of times that's going to be virtual or online. One thing to look at is to look for changes in costs. And we wanted to just put some terms up here. These terms are also defined on NORD. They have a lot of great resources on their website. And I'm sure that links to those will be provided at the end of this, or you can always go to their website. But the big thing is like your premium, and that is the amount that you pay each month for your health insurance. Typically, you and your employer, if it's an employer plan, go into that. Has that amount gone up or down at all? Your deductible, and that's an amount that you could owe during your coverage period before your plan starts to pay any amount towards your care. Has that amount gone up or down? Copays or coinsurance, and that's a copay is that fixed amount that you might pay for coverage service, be it, $10, $15, $20. Coinsurance, instead of that fixed amount, that is a percentage of this covered health service that you would pay. Has that amount changed, gone up or down? Has the network that you participate with, which is the facilities, providers, or suppliers that you have to work with, has that changed at all? For many of our rare disease families, that can make a big difference, if you can no longer go see the doctors that you're regularly seeing. And then formulary, are your medications still covered and in what tier? Formularies is that list of prescription drugs that are covered by your plan. And tiering is a way of grouping drugs into different levels and at what cost. Each tier can cost more and more money. Go ahead and switch the slide. Some questions to ask yourself when comparing those plans is, are those doctors and prescriptions still being covered? What is that total yearly cost going to look like when you add up all of those amounts, those premiums, those deductibles, those out-of-pocket costs? Um, you want to think about looking at that overall cost. Sometimes looking at the most inexpensive plan is actually going to cost you more money when you look at how much you spend in a year. And does the plan cover the services you use most? Not everybody's healthcare usage looks the same, so you certainly want to take everything into consideration. If you can't find the answers to these questions or you need help, on the next slide, we're going to kind of go over where you can go to ask some of these questions. And you can go ahead and change. So, where to get help? Um, if you're doing state marketplace or even, employer plans or government sites, there's healthcare.gov or your individual state marketplace site is going to offer assistance or give you guidance to where to find a navigator. Medicare.gov or your local state health insurance program offices. There's certified navigators or brokers that they are trained by the marketplace, but also for Medicare, there are certified navigators that can help you with that. NORD, as I mentioned, has a lot of great resources on their website, and many times for your specific rare disease organization, your orgs are going to have assistance available to you. And then for your employer plans, your HR or benefits manager representative should be able to assist you with a lot of these things. So, yeah, insurance world isn't easy to navigate. So even those of us that have worked in it, but you can always find a way to take control and feel more empowered. So the goal isn't just to have coverage, it's to have the right coverage. That's the big key. Having insurance that doesn't work for you is kind of a worthless situation. And then here's some what if scenarios. The big thing is everybody always says, if I have a prior authorization for medication, but my plan doesn't cover it, what happens to that prior authorization? And unfortunately, it doesn't matter. Prior authorization does not override your plan guidelines. That is happening to my family. We have a medication that I take. I have a prior authorization that is good through 2026, but we were just notified that the plan has this, my husband's employer is choosing to no longer cover the medication. So we're currently talking with with our physician to find out, is there something else that I could take in place? I'm talking to the manufacturer, patient assistance program, finding out if there are options available to me to have copay assistance where I will end up having to pay cash for this ridiculously expensive drug. I'm looking at the indications that this medication is covered for to see if there's a way to find out if my prescription plan can cover it for a different indication that maybe I can get it covered for. And then finally, I'm going to be my husband's going to be talking with his employer to find out if perhaps they don't realize that this is a medication that their employees and their families need. Many times in an employer situation, you can talk to them and they can reverse their decision. What if my formulary changes halfway through the year? Unfortunately, that happens a lot of times. You have to follow the same situation as the previous. The first thing you want to do is talk to your physician. You need to work with them to find out what is the best option. Are there other medications? Many times in rare, there are not. Then you're going to talk to the manufacturer, find out what assistance they might be able to offer. Then talk to the employer if it's an employer plan. What happens if the only plan available to me does not cover my medication? That is, again, the same situation, talking to physician, talking to then going to the manufacturer for the one medication you need, seeing if they have any options available to you. It's a horrible situation that our families are placed in when we need one specific medication. The other thing is always to look to see if you qualify for Medicaid. A lot of times, that is an option for a lot of our rare diseases, and Medicaid is usually a means to get the needed medications for us. And then if you have to switch plans halfway through coverage year, unfortunately, you would have to start over with all new deductibles, out of pockets, things like that. But you would be then bound by the new plan options as far as coverage guidelines. And I think that is it.
Thanks so much for that overview, Jennifer. That is super helpful. I wanted to dive back into some things that you mentioned over the course of your presentation, things like step therapy and prior authorization.
Yeah.
Would you mind talking about what those things are and how they relate to formulary tiers?
Yeah, most definitely. Prior authorization, unfortunately, it's one of those things that until you get stuck utilizing your insurance, you might not even realize what it is. Basically, prior authorization is what insurance requires. They want to know that you are getting the right medication for the right indication. They're asking your doctor to fill out a form asking why this medication, this service, this piece of equipment is medically necessary. Typically, it has to do with high cost items, high cost medications. Um, and then step therapy is many times they want you to try, sometimes it's a lesser cost medication. A lot of times they're contracted for different medications. Doesn't necessarily mean they're lower cost. It means that your insurance company has contracted better costs for other medications. They want you to try and fail other medications before you get to take the medication that your doctor feels is the most medically appropriate for you. Doesn't mean that it's the best medications to try and fail. It just means that your insurance company feels that you need to try and fail.
Thank you. That's a super helpful overview. You mentioned that you're looking at different indications for what your drug is covered for. Could you explain what an indication is and what you're looking for when you look for those different covered indications that your insurance company says it will cover?
Sure. When the FDA approves a medication, it's looking at what was the medication tried for when they went through the clinical trials and what the FDA then approved it for. For new medications, obviously in rare, I can use the example. My son has Duchenne muscular dystrophy. Most people in rare recognize Duchenne because, we have quite a few now approved drugs. So say they've looked at, Agamree is one of our approved steroid alternatives, steroid type drugs. So its approved indication is for Duchenne muscular dystrophy. Um, people might recognize, other drugs might be approved for blood pressure. Most people are familiar with now the GLP-1s, weight loss drugs. Zepbound is approved for weight loss, but it's also now approved for sleep apnea. So it might be that your insurance plan won't cover Zepbound for weight loss, but it will approve it for the indication of sleep apnea, if that makes sense.
Yeah, that's super helpful. Really appreciate that overview. And then going over to Allison and Jennifer, also feel free to jump in here as well. As a rare patient and a policy expert, what has your experience been navigating the insurance system?
Sure. So, as a patient, I've definitely still experienced many of the health insurance woes that many of us in the rare community deal with. And I definitely haven't cracked the code of fixing all the challenges that I experience with insurance, but I think that my policy background has been a helpful tool in navigating it. I think that first off, it's been helpful when it comes to selecting a plan that's right for me. So when you're looking at the benefit selection guide, as Jennifer was getting into, there are a lot of options and they're riddled with acronyms and details about in-network versus out-of-network and copay versus coinsurance and things like that. And I think it's been helpful in understanding what I'm looking at and how it'll impact my care specifically. So this has been especially relevant for me with being on state regulated insurance. There are often additional insurance consumer protections at the state level, such as prohibitions on things like step therapy in certain circumstances, or requirements to cover certain things like biomarker testing or medical nutrition products. And these obviously vary state to state, but being on state regulated insurance and having a policy background, it's been helpful for me to know what those protections are and how they interact with my care. So, an example that I have of that is looking at the formulary for my plan. I saw that step therapy was listed as a requirement for a medication that I'm on and I've been on stable for several years now. And what this would mean is that the insurance company would want me, like Jennifer was saying earlier, to try a less expensive medication and fail that medication before they'd cover the more expensive medication that I was already on. And this would have been really disruptive to my care. But with my background, I know that there's a law in the Commonwealth of Kentucky where my plan is regulated that says that if a patient has already tried and failed an alternative medication in the past, or if they're already stable on a medication for a period of time, the insurance company can't make them go through step therapy again. So because of that, I could expect that I wouldn't have to go through that step therapy requirement to access the medication that I was already stable on. And then something else that I look at as well, as Jennifer was saying as well, is whether my medication is listed in a specialty tier and if I'll be paying a copay or coinsurance. With coinsurance being a percentage of the covered service that you'd pay rather than a fixed amount. If a medication that you're on, especially, certain biologics and things like that, where they can be thousands of dollars list price, if you're paying a percentage of that as opposed to a fixed amount, that percentage can still be thousands of dollars for you. And so I think understanding that and understanding how your plan is regulated, how applicable laws might help or hinder your access to care, and also really drilling on specifically the types of care that you use the most and how those are covered under each plan can be really helpful in selecting the right plan for you.
Yeah, that's super helpful. Really appreciate that overview. I also know that you had some challenges kind of going through that insurance process previously. What role have state agencies helped in playing, and it's played in helping to get your care approved?
Yeah, so I had a medication that I'd been on for a few years at one point that had previously been covered by my insurance plan, and they abruptly had stopped covering it, despite there being no therapeutic equivalent on their formulary, and my having already tried and failed the alternative medication that they wanted me to try instead. At this point, I was on a state regulated plan that was based in Virginia, and I was actually able to request an external review of that denial by the Virginia State Corporation Commission, which is within the Bureau of Insurance in Virginia. And upon that external review, they did overturn the denial that my insurance company had made. And many states have these consumer protection entities within the Bureau or Department of Insurance. It varies what it's called state to state. And then some also have a health insurance specific ombudsman within that office. And those folks are there specifically to help with things like this. And in my experience, at least, they are very knowledgeable about these processes and they are there because they want to help. And so I would definitely recommend, especially if you're on a state regulated plan, reaching out to those folks.
I know you've mentioned state regulated plan a couple of times during this conversation. There's so many different plan types. It's a little bit challenging to keep straight. How do I know that, my plan is federally regulated versus state regulated? If I have Medicare, if I have Medicaid, if I get my insurance coverage through my employer, can you talk me through kind of how I know what's state regulated, what's federally regulated?
Sure. So I would like to start out by just saying that it's really not cut and dry a lot of the time. So, if you're on Medicare, your plan is going to be federally regulated. That's one of the easier ones to tell. But with Medicaid being a state and federal shared program, there can be state laws that apply to Medicaid as well as federal laws that apply to Medicaid. And employer-based insurance, while a lot of larger employer-based plans are obviously, ERISA plans that are regulated at the federal level. There are smaller employee plans that can be regulated at the state level. And then if you're an employee of the state, your insurance is, typically regulated at the state level as well. And so I would say I'd probably ask whoever is helping, get your benefits in your HR department or however you're accessing care, what regulations apply, whether it's just state regulations, just federal regulations, or a combination of the two, because it can really be difficult to tell without directly asking since it's not so cut and dry all the time.
Yeah, that's super helpful. So we've seen that a number of large employers have announced layoffs this year. Jennifer, I wanted to go back to you and ask, what happens if I lose coverage through my employer? Where do I then go to get additional coverage?
If you lose coverage through your employer, they do have to, you have first the option of COBRA, which would be to, pay out of pocket to continue your employer coverage. Typically that can be very expensive, but that, is an option you have initially. But then that would be a qualifying event that would open you up to apply for an ACA plan. So, you're not just suddenly stuck. Also, looking at income guidelines, that would be something to reach out and talk to your state Medicaid agency to see if you qualify for Medicaid, or your children would qualify for CHIP or state Medicaid. So, as soon as you know that you're going to be losing your job or employer coverage is going to stop, you want to start looking at those state ACA plans and Medicaid coverage.
Yeah, that's super helpful. And where would I go to find those Medicaid income guidelines? Would that be on the state Medicaid agency website, or is that housed somewhere else?
Typically on looking on, you could just Google, for me, it'd be, Michigan state Medicaid guidelines.
Got
It
it.
would
And
be,
would that be
yeah.
the same for every state? Is the income guideline going to be the same for every state, or is that going to change depending on the state?
It would depend on the state.
Got it. Yeah, that's super helpful. Um, I know you've both talked a little bit about working through an insurance denial. Could you talk us through what that experience was like for you, and what happens if they say no again?
Allison, do you want to take that one?
Sure, I can go ahead and start. So, yeah, so I've worked through an insurance denial before. I would say that for me, what was helpful was working with my clinician and with the folks in their billing department, especially on that. You can appeal insurance decisions, and working with the folks in the billing department on that appeal was really helpful for me, especially at a specialist office where they often have multiple patients who are on these kind of lesser seen medications, or requesting coverage of a procedure that the person looking at a prior authorization request might have never seen before and doesn't necessarily have a ton of background with that. These folks in the billing departments, they see this kind of thing, if they're working in a specialist office where they see a lot of patients with this specific condition. They're going to be familiar with the options available and they can help you navigate that process. As far as, what if they say no? There are multiple levels sometimes to an appeal process. As I mentioned before, I went all the way up to an external review, which did take, I think, close to 90 days to get an actual determination on that external review process. But I was denied twice before I went up to that external review. And as I was saying before, having a policy background and knowing the law and step therapy in that jurisdiction, for me, I was like, yeah, bring it on. We'll go to the external review, and eventually it did end up being overturned. And then the next year, when because when you go through this external review process, it still is only for that year that you're going through it, and they can and sometimes will deny the medication again, like coverage of the medication again the next year. But I was able to call the Virginia Bureau of Insurance, obtain all of the records from my external review, and have them sent to the insurance company. And when that medication was denied, and they approved coverage for it 2 days later in that case, after seeing all of the documentation that I'd gone through the external review process and everything, and was going to do it again if necessary. And so, that's what my experience at least has been working through those denials.
Yeah. I just want to add, so I worked as an appeals nurse for many years. And, the biggest thing is to understand why something is denied. I think a lot of places have very templated appeal letters, and they don't always address exactly why your denial has taken place. So making sure that you read your denial letters very carefully so that you can craft an appeal letter that is specific to your denial. Um, Always appeal. They insurance companies are going to hope that you're not going to. Let's face it, we're busy, we're exhausted, we are working so hard trying to take care of, our families, ourselves. We don't have time to appeal, but you have to do it. Finding people to help. I know Nord has people available to help you with your appeals. Doctor's offices are less likely sometimes to appeal these days, we're finding. And the other thing is, just because your plan might say your rare disease drug is experimental investigational, that does not mean that it is. And make sure that when you're asking for an appeal on an investigational and experimental drug, you ask for a medical necessity review, because especially on those external reviews, your plan is going to send it off specific and just ask for an investigational experimental review, which is different on an external review than a medical necessity review. They're just going to say, yep, the plan says it's investigational experimental, and that's what your policy says. Whereas if you ask for them to send it for a medical necessity review, they're going to look at it differently. So that's just something to keep in mind, is the language of what type of review is being requested in the appeal really makes a difference. And not everybody understands how things work on the appeal sides.
That's super helpful. You've both mentioned going to an external review process. Could you talk me through, how do you eventually get there? Are there a number of steps that you have to qualify within your plan before going to an external review, or can you just jump straight to an external review the first time they say no?
Well, we should also say not all plans allow external reviews. That's if you have an employer plan under ERISA, they don't go to external reviews typically. That's a Department of Labor option, and Medicaid plans typically are going to go to a hearing type situation, but the plan dictates what your appeal options and levels are. So some plans require that you follow every single appeal option that they have in place. And that's going to be within your plan documents, is they're going to spell out what their appeal process is and how many steps you take to be able to get to an external review. Um, so every plan though, typically they'll deny, you'll have 1 to 2 internal appeal processes, and then whether you go to an internal board. Sometimes, with employer plans, you might have a union board that reviews things if it's a ERISA plan, or they might allow you to go to an external reviewer. It's just really going to be plan specific.
Got it. That's super helpful. And then Jennifer, going back to something that you said at the beginning of your presentation, you mentioned that you've reached out to manufacturers about patient assistance programs before. We've gotten a lot of questions in the Q&A about how to get access to, kind of things that help you afford your medication. Could you talk a little bit more about that, manufacturer assistance programs and other ways you can, find to help afford your medication?
Mhm. Um, I shouldn't say all, but many especially some of these rare disease medications or more expensive medications, the manufacturers have put together patient assistance programs or copay cards. You cannot use these programs if you have Medicare or Medicaid. Typically, Medicare has some workarounds depending on your plan. But these programs are designed to help you afford your copays. Now, Allison can probably go into there are, insurance plans sometimes have things like copay accumulators, maximizers, minimizers to try to prevent beneficiaries from utilizing these plans. But basically, um, these patient assistance programs can help you get access to their medications, including helping you with appeals, things like that. But then they offer assistance to help you afford these medications.
Yeah, that's super helpful. And just for reference, accumulators are oftentimes something when the manufacturer gives you a copay assistance card that is loaded with a preset amount. You then go pay that copay assistance card at the pharmacy. The insurance company takes all that money, but then doesn't apply any of that money towards your deductible. So you still need to spend more money in order to reach your deductible before they start to cover other things. So it's pretty bad. Frankly, they're getting their money either way. It's kind of unfortunate for the patients. And we've taken strong position against accumulators, maximizers, things like that, and that's something that we're continuing to advocate against on both the state and federal level. Speaking of state and federal level changes, Allison, I'd love to know, are there any changes to healthcare plans that we should know about from a policy lens?
Sure. So I'll go through kind of by different types of insurance. So starting with Medicare, there have been a number of changes to Medicare in the past few years that could have an impact on rare disease patients. So first, there's a $2,000 annual out-of-pocket cap for prescription drugs that are covered through Medicare Part D or a Medicare Advantage plan that includes Part D coverage. And so this means that you can't pay more than $2,000 per year for drugs that you get at the pharmacy counter if you're under one of those plans. So second, patients can now enroll in a pay over time plan for Part D drugs called the Medicare Prescription Payment Plan. By opting in at the beginning of the year, you'll be able to spread the cost of your expensive drugs out over the course of the year rather than paying for the drug all at once up front. And you can use Medicare.gov to learn how opting into the Medicare Prescription Payment Plan could potentially impact you. And then third, Medicare is now able to negotiate the price of some drugs directly with the manufacturer. The agency that administers Medicare, the Center for Medicare, also known as the acronym CMS, is looking to patients to help them learn more about how drugs that are selected for negotiation are used. So if you use one of those selected drugs, you can either submit written comments to CMS using a web portal or apply to participate in a roundtable discussion on that. And so both ways that you participate will be anonymous, and NORD will be sending out some more information on this topic when the time comes. Moving on now to ACA plans. So Congress right now is debating something called a premium tax credit for ACA or marketplace plans. Premium tax credits make it less expensive to buy insurance. So unless Congress passes an extension of the premium tax credits, which are set to expire, the cost of your premium on an ACA plan is going to go up significantly. And so that's definitely something to keep an eye on. And then on Medicaid, so earlier this year, as many of us are, I'm sure, aware, Congress passed a law that required states to make changes to their Medicaid programs beginning in 2027. So some of these changes include increasing the number of times per year that single individuals have to reapply for coverage, requiring single individuals to demonstrate that they're working in order to maintain coverage, requiring some people to pay cost sharing and premiums on Medicaid, and reducing funding to states to run their Medicaid programs. So taken together, we're concerned that these changes could make it harder for patients to access the care that they need and reduce the generosity of the services that Medicaid programs are able to offer. So NORD is working on finding ways to reduce this harm to our community. But we definitely expect there to be an impact to the rare disease community as a result of those changes to Medicaid as
Yeah.
well.
Thanks, Allison. Really appreciate that overview. And I would just flag that this is something that NORD is engaged on extensively. It's something that we have really met with legislators on. In fact, we were just on the Hill last week talking to legislators and their staff about some of these changes, how we want them to ensure that they're protecting the rare disease community. But in this really challenging political climate, it's a little bit hard to know what can be done to make our voices heard. Do you have any recommendations on kind of what those conversations can look like and who to reach out to ensure that rare patients are protected from some of these healthcare changes?
I think from my perspective, now more than ever, it's important to be contacting your elected officials about the challenges and the changes that you're experiencing with your healthcare coverage. If your insurance premiums are going up, if you're no longer to access Medicaid services, if you're being forced to go through step therapy or prior authorization that is delaying or denying access to medically necessary care, your elected officials need to hear about it from you. They need to hear that it's a top priority for you, and they need to hear that you will hold them accountable at the ballot box if they're not advocating for the needs of their constituents.
Yeah, super helpful. Thanks, Allison. And then Jennifer, one final question for you that we've seen come through a couple of times. We've heard that our rare disease community has a possibility of receiving a first approval for a drug this year. How do we know if our insurance company is going to cover the drug?
That's such a hard question because, we've already, we know that some even rare disease organizations have gotten approval just at this year, and we've not seen any of the policies come out yet to know who's going to cover it. And, it's a hard thing. Um, you know, we know that typically if you have Medicaid coverage, you have a very good chance of getting coverage because, there's going to be agreements signed for coverage there, where the big question is always going to be is what is the coverage criteria going to look like? It used to be typically coverage criteria would look like what the label match the label that the FDA put on there. Now, many times it looks like the clinical trial guidelines. But as far as whether or not, your ACA plan or your employer plan is going to cover it, we just don't know. And that's a really bitter pill to swallow. If your plan is not covering it, that doesn't mean you can't or your physician can't appeal. You can ask, you can go to your employer. Your physician can appeal for coverage always and ask.
Yeah, that's super helpful. And just to put on all of your radar, Medicaid is required to cover almost every single drug that is approved. But as Jennifer said, a lot of times, Medicaid programs will do some shenanigans to either delay the coverage of the drug. So, for example, these gene therapies that are coming out that are very expensive, as Jennifer said, they'll be covered to the clinical trial population rather than to the approved FDA label. And oftentimes that clinical trial population is a lot more restrictive. So let's say, for example, a drug is covered on the FDA label for individuals between the ages of 1 and 6. If it was only tested in a clinical trial population of between the ages of 2 and 4, sometimes Medicaid agencies will only say that individuals between 2 and 4 can get access to that drug, even if it is approved. Another thing that we've seen recently is certain insurance companies blanket denying any approvals for drugs passed through the accelerated approval pathway, which is when FDA says that the early clinical trial returns for a specific product show that this product is both safe and effective. Those manufacturers, as they're doing the clinical trials, need to continue doing follow-up research to ensure that these products are safe and effective, but FDA has determined that they are safe and effective for the time being. We've seen that in New Jersey and Massachusetts so far, and we really just think that is a way for insurance companies to save money. There's really no clinical evidence behind it. Nearly every single drug that is approved through the accelerated approval pathway eventually receives kind of a full confirmation when they pursue those confirmatory trials. So we know that this is not backed by any type of clinical science. This is just a way to restrict drugs to patients. And that's something that we are advocating strongly against. I know we are running up close to time. Jennifer and Allison, is there anything else that you would like patients to know as they pursue this open enrollment process?
I think, always know you have the appeal options. Going back to the accelerated approvals, none of those policies, as far as I'm aware, have stood up to a single appeal. You can say we're not going to cover it, but fight is the biggest thing for me.
Yeah, I would echo that. Just reiterate what we were saying earlier is when you're looking at plans, paying the most attention to the services that you utilize the most often is going to be, really important. And specifically, requesting, sometimes the formulary isn't always included when you get the, package to look at your benefit selection for the year. Requesting that formulary and making sure that you have access to all the information that you need to make that decision.
Yeah, really appreciate that time. Want to just flag a couple of things before we hop off that NORD is advocating on the coverage side for our end of year federal priorities. Number one, we've received a number of questions about how to get access to care out of state, especially if you're on Medicaid. That can be really, really challenging. If you're in a state that doesn't have the provider that you need, a lot of times there are only a handful of providers that are knowledgeable in your condition spread across the country. And if going access to that provider out of state can be really hard. We are working on a bill called the Accelerating Kids Access to Care Act, which would streamline that process for you to go see that out-of-state provider. So for example, if you're in Texas, it makes it faster for you to go see a provider that you need to go see in Boston. We're also working on, as Allison said, on the extension of the ACA's premium tax credits, which reduce the cost of premiums going into the course of next year. And then finally, we're working with the Center for Medicare on ways to improve that patient listening session and improve the changes to Medicare that have come out over the past few years. We have a meeting coming up with the Center for Medicare in January, and we'll be flagging some of our concerns for them, as well as submitting written comments. We've also, as I mentioned, been meeting with legislators and regulators on the federal level on a consistent basis, and we'll continue that advocacy for the rare community. I wanted to thank you both for your time. Really appreciate all the fantastic information that you've been able to provide, and thank everyone else for participating today. You had some fantastic questions. We'll be following up with some additional resources and a recording of the webinar that you can follow through again. And please feel free to reach out to NORD with any questions that you may have. Thank you for your time.
Thank you.